Before we discuss the different hypersensitivity reactions, let's see how is our body's mechanism reacts to these hypersensitivities. What is an allergen? It is a magic spell. No. Allergy is an overreaction of our immune system to usually harmless substances, like peanuts, milk, pollen, and etc. These substances are called allergens. Our immune system has white blood cells or lymphocytes which protect us from foreign invaders, such as bacteria, viruses, parasites, and etc. These invaders are called antigens. When a lymphocyte detects an antigen, it produces antibodies. Antibodies destroy antigens and thus protect us. Now, if an allergen such as pollen inhaled by an allergic person, the lymphocytes of the allergic person for unknown reasons think that the allergen is an antigen. Hence, lymphocytes overreact and produce antibodies which start attacking the allergen. Besides this, as a protective response, some immune cells also trigger production of excess mucus, resulting in running nose. They even give rise Hypersensitivity refers to abnormal reactions of the immune system against certain antigens. It includes exaggerated reactions to otherwise harmless environmental antigens, commonly known as allergies, and inappropriate reaction against the body's own antigens or autoimmune diseases. Reactions can range from a mild rash to damaged organs to fetal anaphylactic shock. There are two principal groups of factors contributing to hypersensitivity. Number one is imbalance between effectors and regulators of immune response. In some people, mechanisms that normally moderate the immune system are compromised, causing it to overreact to harmless non-infectious antigens. Self-reactivity of immune cells during their development in the thymus and the bone marrow. T cells and B cells learn to not react to the body's own antigens. Self-reactive cells are normally eliminated. But in some people, some of these cells escape and may attack their own tissues once activated. Hypersensitivity reactions only occur in pre-sensitized individuals. Patients must have had a previous contact with the antigen which produced no symptoms, but during which the body had started making antibodies or activated immune cells that may cause symptoms in subsequent exposures to the same antigen. Hypersensitivity is classified into 4 types based on mechanisms of action. In type 1, hypersensitivity, a previous exposure to the antigen results in a production of a class of antibodies called IgE. IgE molecules bind to the receptors on the surface of mast cells and basophils. Upon re-exposure to the same antigen, or sometimes a similar antigen, the antigen binds to adjacent IgE molecules, bringing the receptors together, triggering a signaling cascade that induces the release of histamine and other inflammatory chemicals. These chemicals cause dilation of blood vessels, smooth muscle spasms, and are responsible for symptoms such as edema, rash, difficulty breathing due to bronchospasm, abdominal cramping, vomiting, and diarrhea. The reactions are immediate, within minutes of contact with the antigen, and can range from mild to severe. Severe reactions may lead to anaphylactic shock, a life-threatening condition in which blood pressure drops and airways narrow to a dangerous level. Most allergies are type 1 hypersensitivity reactions. In type 2 hypersensitivity, previously formed IgG or IgM antibodies bind to antigens on the surface of a particular cell type. Antibody binding marks the cells of destruction, either by the complement system or phagocytosis. The antibodies may also interfere with normal functions of the cell without killing them. Type 2 is at the basis of many autoimmune diseases, where the body produces antibodies to destroy its own cells. Another example is hemolytic disease of the newborn, where maternal antibodies bind to the antigen on the surface of fetal red blood cells and destroy them. Type 3 hypersensitivity reactions are also mediated by IgM or IgG, but in this case, the antibodies bind to free-floating antigens, forming antibody-antigen complexes. The complement system is activated and inflammation results, causing damage to the affected tissue. A typical example is serum sickness, induced by a large amount of antigens in the blood. Immune complexes are deposited in the walls of blood vessels, triggering their inflammation or vasculitis. Type 4 hypersensitivity is a delayed reaction mediated by T cells. Pre-sensitized T cells are produced during a previous contact with the antigen. Upon re-exposure to the same antigen, T helper cells release inflammatory cytokines, while T killers induce cytotoxic reactions. Typical examples are allergic reactions to substances that come into direct contact with the skin, known as contact dermatitis. Type 4 is also the basis of tuberculosis skin test. Rise to itching throat and watery eyes, thus causing an allergy.